Running Industry Midwest, and we're going to cover the information on COVID-19 Preparedness Plans. And for our folks in Minnesota, this will be very important to cover the information that actually the people that are going to be inspecting our facilities related to this item. But the people that are outside of the state of Minnesota, I hope that you will find this information helpful when you're trying to put together any kind of written plans to cover this COVID-19 coronavirus issue. Let you know that Cathy Malinowski will also be unmuted and will be able to speak during this presentation, this webinar. We did get some preliminary questions from people just today, so we'll try to address those questions today. The other way that you can address questions, since we have a large group, is to go to the chat box and put your questions into the chat box, and we can cover those kind of questions. I'm going to ask Cathy to monitor those chat box questions, and then also the questions that we got earlier in the day. Maybe we can cover some of those items during my presentation this afternoon, or certainly afterwards, either in our hour that we're going to cover this material here, or sometime later on, maybe with a personal email to somebody who's got a specific kind of question for their company. Anyway, so that's me, Paul, and that's Cathy there. There's contact information for email and direct dial number to reach out to us, not just with this COVID-19, but any kind of environmental safety issue, OSHA, EPA-related kind of issue that may come across your desk or your email, or anything in your mind on those kind of issues here. That's all we do here, is cover those environmental health safety items. But this afternoon we're going to specifically focus on the COVID-19 stuff, and actually more specifically on that. We're going to cover this whole thing with COVID-19 because what we've noticed, Cathy and I have noticed, is that there's people that have different kind of plans and memos and emails, and there's lots of plans that are out there, lots of templates that are out there, and so you're probably inundated, and you probably have COVID-19 written plans or emails or memos or what have you too. So for those people that actually do have a written plan, either based on the information that Cathy and I previously sent out on our website or through e-loops, it would be a good idea if you could grab those plans that you have right now, and what you could do is walk through your plan as I go through these slides and see if you need to revise your plan slightly or to some degree to get it to the Minnesota OSHA standards if you're in the state of Minnesota. I think the reason for this webinar, just to back up a little bit here, is that there was an email that was sent out from DEED, which is the state of Minnesota agency that's over here. They got some of the printers concerned that there was some new regulation that was going on over here, and we're going to talk through what that all means. But and so that's why we did the webinar over here. But let me also kind of, before we get into the heart of the matter of this afternoon's webinar, is I'm kind of curious for the people that are attending this webinar this afternoon, if you have had notification for the Minnesota OSHA requirements from us at PIM. My concern is that somehow we're not able to get information out to our members or non-members or anybody in the state of Minnesota, specifically on the Minnesota OSHA rules. I know that we had some messages in our e-loops during May, so this was like almost over a month ago. So I got some homework for you right off the bat. If you are getting the e-loops and you did see this information back in May, we had some different messages out in May that stated that you need to review your plan to see if it met the Minnesota OSHA requirements. If you're getting those e-loops and you didn't follow them, that's fine, that's one thing. But if you really are not connected at all to the e-loops and getting information that we're trying to send out and let you know about changes to requirements in the EHS area, you got to get access to those e-loops. My information is usually pretty brief, trying to get to the point so that you can quickly scan that information. So you got to get access to the e-loop, because there's no other way that we can really reach out to our members to let them know of a change, not with COVID-19, but any kind of EHS regulation. So I urge you to get access to our e-loops. Those are electronic newsletters. You can get a hold of Ben. Sadie puts those things out, and that's maybe going to be our only way to connect with members that are out there when there's changes like this that are going on. The other thing I want to urge you to do is to get access to PIM Connect. It's called PIM Connect. And what happens there, because I'm going to refer to a document that I think Chris sent out earlier that talked about a document that was put into PIM Connect. And we had some verbiage on how to use that document from the Printing Industry Alliance, which covers COVID-19 and their template plan. And so, and we're going to talk about that here in a few minutes. But to get to that, again, you need to get access, not to the website, you need to get access to PIM Connect. And also, you got to reach out to somebody at PIM, and I did talk to Ben about this earlier. You can contact Ben also over at PIM to try to find out and get into access to PIM Connect, because the one document we're going to talk about here is accessible through PIM Connect. And the reason why it's not free to everybody out there is because it is free for members, and it does cost, I think it's $99 for non-members. So specifically, let's get started on the federal OSHA, because federal OSHA is actually in the states of North, South Dakota, and Nebraska for our region. And I think that's all we're covering is our 5-state region that we've got over here. Iowa OSHA does have their own OSHA program, but they follow pretty close to what federal OSHA has. So federal OSHA does not have specific regulations. And if you've had any issue or visits from OSHA on COVID-19, you'll find that they refer to a lot of guidelines and recommendations and information. And I know federally there's been pressure with Congress for federal OSHA to have a specific regulation. That question was actually asked at a webinar that Printing United Alliance had just the other day. And I agree, I don't think that there's going to be any specific regulation, any specific law that you need to follow in those federal OSHA states like North Dakota, South Dakota, and Nebraska. And I think the same thing holds for Iowa. But in Minnesota, it's a Minnesota OSHA plan, and the regulations that you need to be aware of that you follow are not federal OSHA regulations. There's Minnesota OSHA regulations. Now, a lot of times they look the same, but there will be differences. And in this case, on the COVID-19, there's differences. So you probably had different sources of templates that you're using, that you've already used. The one that I want to recommend you take a look at is the one from the Printing United Alliance. That's what that PUA stands for. And again, like I said, Chris did put that on the PIM Connect. A few comments about it. I did print it out and read it. It's 52 pages long. I would not recommend you follow that template, especially if you're in the state of Minnesota, because if you follow that template, it's not going to look familiar to what your Minnesota OSHA inspector is looking for. But I think it is a good document because it has a lot of great reference material, and I think that's the intro that Chris did on the PIM Connect. It's another template, but it's a very lengthy template. And it has some great reference information. It has a sample visitor questionnaire form. It has a sample letter that you can use to hand out and discuss with employees who have had close contact with an employee that has been tested positive for COVID-19. It has sample FMLA and sick leave policy, so it's got a lot of reference information, but again, it's 52 pages long. It's going to be, I think, difficult to find stuff in that document if that's the one you're going to use as the one you're going to communicate to and show to OSHA and so on and so forth. Because the reason why it's so long, it's got some other information that you may not even need to have. It talks about how to make your own disinfecting bleach solution. And if you're not going to even have your employees do that, then why have it in your plan? That's my personal opinion. It also even talks about how to conduct safety committee meetings differently in this COVID-19 environment. And if that's something you want to read, fine. But I don't know if you really want it in an action plan that you're going to refer to quickly on your response to COVID-19 issues. So let's get to the Minnesota OSHA template. I recommend you follow that because that is actually what the inspectors will follow if they're going to do an inspection in the state of Minnesota at any business. That includes the meat packers and it includes the printers. It includes any kind of business and retail establishment and so on and so forth. Another bullet item that you see there is Minnesota OSHA and how they may enforce the requirements. I have contacted Minnesota OSHA, and specifically what I think we should be wondering about is the enforcement group that's there that would actually knock on the door and come into the building. But when before I get into that, I want to cover this other last bullet point on this slide over here that talks about Revision 3 users. A lot of people may not know that we are on our 4th revision that is in the Minnesota OSHA website, and that's what we have on our website that's linked. We make changes to the revs, so that we have already advised people when we didn't think that it was going to change again, and OSHA changed, indeed changed it again. So we have referenced a revision 4. So there may be people in attending this webinar that may be thinking, well, wait a minute. I got the Rev 3, and that's what I've followed all along over here. And if you have a written plan that followed the template from our website, and which was the federal OSHA template, which was a revision 3, those people are probably okay with the written plan. When I took a look at both plans, the Rev 3 and Rev 4, there was only one difference that I saw that was a bigger difference between the two plans, and that's where they added take a look at your whole building. Besides just ventilation protocols, your whole building, if it's been shut down for any length of time, you need to take a look at your whole building to see if you need to flush the drinking fountains and take a look at your water supply systems and things like that. So if you are in a Rev 3 user, you're going to be in fine shape. That was a specific question that I did ask Minnesota OSHA and the enforcement group over there. So how would actually Minnesota OSHA enforce this issue? I think the one thing you need to be aware of, the bottom line is, what I've gotten from Minnesota OSHA is that if you have no written plan, if you are not taking any action on COVID-19, no disinfecting, no health screening of visitors or employees, if you're doing nothing at all, they will issue a citation. The citation that they are only able to issue is a general duty clause, which would be a serious citation. Now, the figures that I think OSHA was quoting to me was like a few $1,000, and they thought, well, that's not that much money. But I think for some of the small printers, anything is a lot of money. So be aware that you need to have something in writing. And my advice, again, and Cathy's advice, is to follow as closely as you can to what the Minnesota OSHA people have in their template. And we'll talk about that in more detail as time goes on over here. But I think if you have something in writing and you're doing a good job in following it, and let's say your plan doesn't specifically match up to the Minnesota OSHA template that we're going to be covering here today, and that's on our website, I don't think you're going to have a lot of problems with Minnesota OSHA. They're really going to they're not going to nitpick our plans. So that's the good news. They're not going to nitpick our plans. And I think the likelihood of them coming out inspecting is probably going to be something that you should be aware of through employee complaints, or if there's been an outbreak that gets into the news and the media, like with Amazon and things like that are going on. That's when you're going to get visits by Minnesota OSHA and maybe the Minnesota Health Department also. So, and if there are questions, you can put them in the chat box. But that's pretty much, I wanted to pass that along for your information as to how Minnesota OSHA will view this whole COVID-19 planning in the template. So let's show you, because even after this webinar, you've got to get to our website to see if anything's changed. Right now, it's revision 4. I didn't even think there'd be a revision 4. I thought it was revision 3 and we're done. Now we got a revision 4. If there's going to be a revision 15, you're going to have to, again, watch our e-loop, because Paul or Cathy's going to tell you that there's another rev, and it's on our website. You got to go to the website. That's it. And that's our website right there, the PIMW.org. When you get there, you're going to get to this page that's got this COVID-19 on it. So for those of you who've been here already before, sorry that I'm boring you guys, but there may be people that are in attendance here that have never been here ever before. Cathy picked this icon here. Looks like the COVID virus here. Click on that. And when you come to the very top part of the information on COVID-19, you're going to see the two parts that we're going to spend time this afternoon talking about, and that I would urge you to take a look at in more detail, because this afternoon, I'm not going to bore you to go through 5 hours of how to do this plan. It's going to be this short, concise 1-hour webinar. But when you take a look at the first one over here, this template, it's in Word and it's a PDF, and this is the latest revision here. The one thing that's happened with these due dates and stuff is that early on, like I said, in May when we got the e-loops out there, we urged people to get in writing, and now all of a sudden people have read that even the critical businesses has to follow the same plan, and the due date is coming up on June 29th. Again, if you got a plan that's a prior revision from OSHA, or if you got a plan, I think you're in pretty good shape. If you got nothing to do at all, nothing in writing at all, you're going to have to get going in progress. The other thing to keep in mind for OSHA, I don't think I mentioned this earlier, I have during our other visits with other printers, is that even if you're starting to work on a plan, you're in a better position with OSHA when they're doing inspections for lockout, tagout, any kind of issue, where you say that you're aware of the regulation, you're working on the plan, and it's not done yet. You're in a better position by saying those things and doing those things than you just said, I didn't do anything at all, or I don't even know anything about it. Then they're gonna issue citations for any of these kind of OSHA safety issues. Okay, back to the template here. That's the first thing that you can click on to get the template. You can put your own company name in there and use that template to go through. We've had one printer do that before, and he thought, this works for me. So that's what we're going to cover here first, and it's going to look like that. Once you open it up, you see these parts in red. That's the stuff you're going to have to fill in, and we're going to walk through those parts of the template here this afternoon. The second part we're going to talk about, not in a lot of detail, is this Preparedness Plan Guidelines for Manufacturing. And that's basically the two documents that you should be looking at if you're concerned about OSHA and what they would enforce or not enforce. So we're going to spend some time on this Guideline for Manufacturing document, and that looks like this. And again, that's on our website right there. And we're going to talk about this, like I said, in some degree here. Okay, so let's get into the template itself. Again, that was the first document that we have. So I'm going to break it down into the major parts of the template and cover these items. The first part that you're going to have to do in your template is identify a plan administrator. In writing, who's going to be putting together the written plan. There's also a section in the introduction on their template that they've got where you need to describe how workers are going to be involved. Now, they did get very specific, and as you take a look at the document later on, they do have words in red here that they talk. So I'll give you an example of how lengthy this thing could be, and my advice on how to make it not as lengthy as possible. They talk about, describe how workers' suggestions and feedback has been solicited and requested, how worker concerns have been addressed, and how such suggestions have been integrated in developing the plan. So that's a lot of words. Maybe it was somebody from DEED that came up with that. I don't know. I don't know the people that well. But in any event, I think if you have some description as to how you're involving the workers in developing the plan, to some degree, I think you'll be covered. All right. So the other part that's in this intro of the template is you need to describe in words that you used or reviewed somehow this preparedness plan requirements guidelines for manufacturing document. And that's that second document that we've got on our website. And we're going to talk about that towards the end of the webinar here this afternoon. But you need to have some words that you've at least looked at and incorporated some of that information on those guidelines. And some of the information on those guidelines helps us to try to get more specificity and information on how to deal with ventilation, for example, and other stuff is going to be, I think, a little too confusing for us, and we won't have to get into that kind of detail. You'll hear more about that a little bit later on. So that's the intro part that you need to have in a template. Then they get into some specific sections in their template here. Their first major area that they're covering is ensuring that sick workers stay home. And what you want to do there is describe your health screening approach. And it doesn't get any very specific there. It does not require temperature screening. People are doing temperature screening. Some people are, some people are not. There's no requirement to do so, but you need to just describe what you're doing with health screening. So what's going to happen is after you start developing the plan, then you're going to have these other kind of questions as to what do you want to have in your own health screening, and is it acceptable enough? And like I said, as long as you're asking some of the general kind of questions for symptoms, and you're doing some sort of screening, the requirement here isn't that you do 9 points of health screening. It talks about describing your health screening approach. How you want to fashion that is going to be pretty much up to you, and that's where you can get information from the other recommendations and guidelines and CDC and so on and so forth. So I think a lot of people think, oh, you got to do temperature screening, everybody's doing it, and I hear about it in the news, and that's not a requirement. You can actually ask people the question if they have a fever too. If you're going to do temperature screening, which we can talk about later on in the webinar, you need to make sure that people are going to wear the personal protective equipment when they're going to do that kind of health screening, for example. The other thing you have to have in this part of the plan is describe how workers will contact the employer when you're sick. When the employee is sick, you want to set something up for those workers to make sure that they contact somebody so that somebody can interface with that employee and ask why they're sick, why they're not coming into work, what are the symptoms, what's going on. So you need to describe that process. In your written plan, you need to describe your sick leave, when that person is going to be isolated. Another specific example with this template, it does talk about describe your business's sick leave, FMLA policies, addressing situations. And again, you could refer to that, to your other policies, because those are big, lengthy policies maybe in some companies. Just refer that you got a sick leave policy, and you could refer to policy procedure 0001 or something like that. You also need to address in this section of the template, how will employers inform other workers that employees were exposed at work? So in case you do have a positive COVID-19, then you need to have a process where you're going to inform other employees of that. And actually, I think, back to that printed United Alliance document, the 52-page document, there's some nice information in there. So you could grab stuff from there to put in your own plan. You also want to make sure that in writing that you put in your plan, in this section of the plan, that you're going to protect the privacy of the worker's health if there is someone that has been tested or is positive COVID-19. So, I think you kind of get the flavor of this, is that I don't want to read through every point by point on their template. I want to just point out some specific sections in this template that Minnesota OSHA would be enforcing, that basically people from DEED and other agencies of the state has come up with. So social distancing, you need to address that. You need to describe your teleworking approaches, that you have staggered shifts. Information like that is going to be found in that template. Also, Minnesota OSHA has come pretty hard down on the 6 feet apart. It's interesting in their template, and I think even also in their guidance document, they have these words saying that workers must be 6 feet apart. But then as you read further, it says, but if you can't do that, then install barriers, partitions, things like that. So they would like people 6 feet apart. I think it's going to be easier for us in the printing industry than in the meat packers industry, for example, to keep people further apart. But anyway, you need to talk about social distancing. Also put in this part of the plan information about how you're going to prevent group gatherings and meetings and in break rooms and so on and so forth. Also, you need to talk about how phones and pens and desks will not be shared, or if they are shared, how they're going to be cleaned. You need to describe in this section of your plan how you will provide gloves, disinfectants, and you also need to describe in this part of the plan how you will provide instructions on how and when to use PPE, which is personal protective equipment. So that's another acronym I'm going to throw around maybe another time or two, is the PPE. That's what we're talking about here, personal protective equipment, which is basically gloves, face masks, things like that. All right, worker hygiene is the next section. And in this section, you need to describe when workers and visitors are to wash their hands, and they get some specific information in the template that we have, that they wrote up. Wash their hands before eating, wash their hands at the beginning of the shift, wash their hands at the end of the shift, words to that effect. In this part of the plan is where you should be describing the location of where your hand sanitizers are throughout your facility. And also you need to describe how you're going to be instructing workers and also visitors with signage or what it's up to you how you're going to get this information out. Instructions on how to handle coughing and sneezing today, disposing of the tissues, and washing your hands afterwards. So that's in that worker hygiene section. In the next section of the template, there's a spot there to talk about workplace building and ventilation, isn't it? And as I mentioned earlier, in Rev 3, they added ventilation. So if you're dealing off of a Rev 1 or a 2, or if you had another work comp consultant or whatever help you out, that may have been missed completely. And I do urge you to at least take a look at some of these things that are very different from these earlier template plans that are out there. I think the Printing United Alliance has got this one covered too, which is good. So that's why it's just good to keep up to date with whatever is maybe inspected at your facility in the future. So this is a section that's newer with the latest revisions. They talk about workplace building and ventilation. The ventilation one, what they want you to do here is describe steps that you've been taking to improve circulation, to provide more fresh air, and to take a look at your filters that you do have and increase the MERV factor on the filters. If you talk to your maintenance or HVAC people, they may know what we're talking about with the MERV numbers and the filters. And this is actually very important, because the other thing I see that's happened out there is a lot of people talk about COVID-19 on surfaces, COVID-19 on newspapers, and on phones. And this is a respiratory disease. This is something that's carried in the air, and that's what all the face masks are all about. Is it's still a disease which is transmitted from a human being to another human being, and it's airborne. And ventilation is one way that you can really take care of this issue if it's in the air. And the more fresh air that you provide your facility, the better off you're going to be. In this section, they added a new one here in their latest revision, is you should assess other building items. And what they're getting at on that item over there is if buildings have been closed down for months at a time, the drinking water, the water supply, things like that, you know, is there other pests and things like that that need to be addressed? They're concerned that someone has taken a look at those other building issues when things are shut down for any length of time, that people can still use the drinking water and not be harmed in that way.
Paul?
Yeah.
Could you address leased buildings? Leased
buildings. Yeah, that's a good one. I think what's going to happen when I talk to OSHA about that is it's going to be tough for you to go back to the landlord and pressure them to do something different on ventilation. I think if you take whatever due diligence you can to at least let them know about these requirements, that OSHA may be asking these kind of questions, we need to provide them answers if they go down this road, and you know, put them on the hot seat to some degree and say, this is something we got to know about, and it helps again prevent the spread of the virus. So if you can put some pressure on landlords, whoever owns the building that has control over making changes to ventilation, that's as far as you can go. But you can't really, I mean, OSHA's not going to cite the landlord in that situation. It's probably not going to cite the person who's occupying the building. So I think if you can just take some steps to try to address this item as best as you can, that's all you can do. That's it. And Cathy, you know, you can just kind of keep track of the chat questions and the other ones. Maybe we'll cover those maybe towards the end here, maybe if we can do that.
Perfect.
Although what we could do actually is maybe, you know, maybe we should take this one here on ventilation, because there was one question, or some questions that came in about they don't have air conditioning in their shop, and so actually that's a good thing, because maybe you can open up doors and windows, because as much fresh air that you can bring in, that's going to be always a big benefit. But the other related question to this item is that even if they have no air conditioning, they use a lot of fans. And in the OSHA documentation, they talk about not blowing fans on people. So it doesn't say you're not supposed to do it. It's against any kind of law. But I think what they're trying to get at is that if someone has the COVID-19 and you're going to spread it around the whole building, but what can you do? If there's no air conditioning, you're going to have to provide some sort of comfort for the person who may be exposed to some heat stress. So you want to just try to avoid blowing fans on the people. But otherwise, they just want you to take a look at the ventilation and try to make improvements so that you don't have an enclosed building. That's the worst kind of situation. Maybe you've seen things on the news and YouTubes and things like that where you're in an enclosed area like a restaurant, not providing a lot of ventilation, and the COVID virus can spread very easily. So I think that's what they're getting at with ventilation. All right, well, let's see here. Workplace cleaning is another section on the template. And in here is where you want to talk about your general cleaning and disinfecting. You also want to cover the areas if you have a positive COVID-19 case and what you're going to do for a deep clean. And you can certainly do a deep clean. You don't have to hire an outside company to do a deep clean. You certainly could do it if you wanted to, but they just want to make sure that people would deep clean the area where there's a COVID-19 case. In this section, they want you to identify the products that you're going to use for cleaning and disinfecting, and they also want a description of how you're going to provide training for those people who are going to be doing cleaning, and how to use the cleaning products, and what sort of personal protective equipment or PPE that they're going to use. So that's going to go in that section of your template right there. And again, as you go through your own template, if you're doing that, some of the people that are attending the webinar, if you got this covered, then just take a look and see what other things you might have to add to your plan. If you don't have this covered at all, you've got to cover it somehow. All right.
Paul, could we
Yeah.
also address humidity?
Yeah. So on humidity, for back to ventilation, that's a good one actually. In the other document, that manufacturing guidance document that we're going to talk about a little bit later on, that has some very nice information on ventilation and humidity. I think they have a recommendation of humidity levels, but they've got some numbers in there between, I think, 40 and 60% relative humidity. That's the sweet spot for relative humidity for ventilation systems. So that's a nice document. You're not going to find it in the template, but you're going to find it in that other document. So that one's good for that information. All right, let's go back to drop-off and delivery. They want a section in here if you're going to be interfacing with customers or vendors dropping things off. You need to describe your procedure or protocols for receiving materials, and also that you're going to be maintaining social distancing and trying to do contactless deliveries whenever you can. Also, when there are deliveries that are being made, you want to avoid sharing tools like scanners and pens and things like that. So you want to also address that item on drop-off and delivery of of materials like that. Let's see. Now, on the last part of the template that we have, you need to have a section on communications and training. You need to identify how and when your written plan will be communicated to workers, how you're going to do it for visitors, and you're going to describe when your training will be performed, or if it was done already, to document when that was done. You also need to have some statements that the management has responsibility to monitor the plan. And I think this kind of wraps up at least the general idea for this template here is the plan needs to be certified by management and posted and available to all. You could do that electronically if you wanted to. I remember, Cathy, we did get a bunch of preliminary questions on this item on training. So correct me if I'm wrong or help me out on understanding if we're going to cover this. The way you want to document training, the way you want to do your training is totally up to the company. It's totally up to you how you want to do that. But you need to make an effort to make sure that people know that you have a plan, that it's on your internal computer system, or that you're going to post it somewhere. You just need to prove that you've communicated to everybody that you have a written plan, and that you're communicating more frequently the more important parts of the plan: cleaning regimen, PPE use, things like that.
Right, and there is a lot of questions that came in ahead of time regarding training and how to conduct training and what kind of training should they be doing.
Okay. Yeah. So,
and go ahead.
Go ahead.
Oh, yeah. So, I mean,
Oh.
people were specifically wondering if electronic record keeping was okay for training, and I believe that OSHA is totally fine with electronic record keeping. You know, someone was specifically asking if they should use a checklist or a PowerPoint to deliver the training. That would be fine too. They don't have to, but they can.
Right.
I think the bottom line is that the people need to understand what's in the document. And then somebody else was wondering if we have a training protocol for COVID.
Yeah, we do not have anything that's a video, a CD or a DVD or anything like that we have access to. And it's pretty much, I think, really what OSHA wants to see anyway for any kind of training protocol or document. They love things that are specific to your company. If you use anything that's a canned version on any of this information on COVID-19, they're going to say, fine. If that's the only thing you use, they're not going to like it. They like things that are very specific to your company. Let's see. Were there some other questions here before we leave the template, Cathy?
We did have a question early on about Wisconsin and how does Wisconsin fit in with plans and all that.
Good. Yeah. So for Wisconsin, that is a federal OSHA territory. It's not in our area, although we have some Wisconsin members that may be a member of the Wisconsin affiliate over there. And that's federal OSHA, and federal OSHA would be, I mean, if you had something like this, pretty much any kind of template, you'd be fine over there. Because that's a federal OSHA territory. You're just going to have to go with guidelines and recommendation that CDC has got. And if you got pretty much anything in writing and that you're trying to do the best you can to control this potential outbreak of COVID-19, you'll be in fine shape, you know. So for Wisconsin, that is federal OSHA. Let's see, anything else, Cathy, that can you see the chat box?
I have, yes, and I posted in the chat box, you know, Paul, you mentioned that the document, the template from PUA has a lot of good data in there with information on different health screenings. I also posted in the chat box some links to the Minnesota Department of Health. They have some guidance documents that you could use as well. So I've put those in the chat box, and eventually those are going to go onto the PIM website as well.
Yeah, that's good, because there were questions that we did have that Cathy and I took a look at about health screening questions.
Mm-hmm.
Examples of things to ask for health screening for employees. And in that Preparedness United Alliance document, they have a health screening questionnaire which is entitled for visitors, which, you know, I think you could take a look at the stuff that Cathy's just going to post. And again, you can't get the Preparedness United Alliance document on our website because there is a cost for non-members. You can only get that through the PI.
I think people are kind of wondering what other businesses or printers are doing as far as health screening. Are they just taking Are they taking temperatures? Are they asking the questions? That kind of thing.
I think a lot of them are asking questions. At least there's a few that would do the temperature thing. And again, what happens if people follow the news on that one is that you're going to still miss people, even if you take a temperature and they're okay with the temperature. They're asymptomatic people. They're people that don't exhibit a temperature. So it helps. That's why probably the Minnesota people aren't pushing it as a requirement. But I didn't see a lot. I don't see a lot of printers doing it. I think the bigger companies are going to do it, do the temperature checks. But and it's not required, so it's hit or miss. I've seen a few that are doing the temperature checks.
Right, and also some questions regarding health screening. What do you do with the records once you have them?
Yeah, I think. Go ahead.
Oh, and I think that they consider that to be like a medical, there's some, they already kind of know the answer to that. It basically is covered by, I think, EEOC and ADA, I believe, and you need to keep those medical records separate. I think you addressed that earlier, I think.
Yeah, and I think that's the one document I think you're going to put on our website too.
Exactly, and I think I did share that with the in the chat box as well. Eventually that'll go on there too.
Okay, all right.
And it appears, that some of the people are just asking questions, no temperature taking. Some people are taking contactless temperatures, asking questions on entry. And in the Minnesota Department of Health guidelines that they have for, health screenings and things, they do talk about what specific temperatures should you really make note of.
Yeah. Mm-hmm. Right.
Oh,
so
and we do have a question on record retention.
And I think right now, I think as far as record retention for your training records, I would still keep them for 2-3 years or so. I mean, that's a general rule of thumb because the COVID-19 is not going to go away anytime soon. If it continues for a while, you're going to have to keep a lot of those records, even on your training records. That you communicated the plan on such, you'd have to keep that for at least 2-3 years or so, as a general rule.
And then there's a comment here that somebody says that they've seen that PIA suggested keeping, I think, health records for 45 days and then destroying them. I think that is what the comment was.
Oh, and the health record part.
Right.
Yeah, I think, that's probably a good idea.
For visitors.
For visitors, for temperature checks like that, because that's not going to help you at all, a year from now or whatever, because that person's information is not going to be relevant.
Right, for the contact tracing and all that kind of stuff. Right.
Yeah, right. Well, why don't I, should I get to the other 2 documents and we'll go back to questions?
Sure.
Okay, just in case people want to already phase out, because this other document here that we have on our website, you still need to take a look at because the OSHA guy says you're supposed to. So I guess we better. So this is the second document. It's called Preparedness Plan Requirements Guidelines for Manufacturing. This is the one that we would follow. I think there's other ones for construction and retail or what have you, but this is ours right over here. It looks like this. So again, it says in the plan here that the OSHA people would be enforcing, says that you've looked at this thing and you've incorporated information in here. Now the problem with this document is that, again, the way it's written is it says that you got to do these things. So what happens is when you take a look at this document, as I did, actually what it does is it provides valuable guidance for developing, implementing your plan. As I mentioned a little bit earlier, take a look at the ventilation information. It's really nice. It's got those suggested humidity levels over there. But then when you're going to take a look at that, and that's why it's good that you're listening to on this webinar, you're going to take a look and saying, well, wait a minute. There's a line in here, Paul, that says you must make a 6-foot line on the floor in front of desks used by workers. It doesn't say recommended. It says you must. So what does that mean, Paul? Forget it. Don't do it. So that's what I got from Minnesota OSHA on it. They're not going to nitpick to make sure that you start drawing lines 6 feet in front of people's desks. So it's unfortunate that it's kind of written that way. But in any event, so take a look at the document, grab some information that I think would be helpful and valuable, like on ventilation and other stuff there too. But when they do have other things that throw you off, and if you got questions on that, just email Cathy and I and ask. But for now, you're going to find information like that about drawing 6-foot lines on there. Forget it. And like I said, I don't think OSHA is going to cite us for it. So, what other questions, Cathy, are you seeing that are popping?
Nothing. Oh, I think maybe I believe that did you address if we do have somebody that does test positive in the work environment, what do they do?
Yeah.
And go ahead.
Well, okay, so if they come in and they're exhibiting symptoms and stuff like that, you got to isolate that person so they can get home and get medical attention. I think so it's a little bit different if they just have the symptoms or a high fever or things like that. I think if they actually have a positive case that they found out about, then they have to take some other measures. They do need to contact other workers that would have had a prolonged time period that they've worked with. And that's the tricky part. On the privacy part, and I think it was on one of the slides before, you can't give the person's name out. The other employees may figure it out, but you can't give the person's name out as to who tested positive. But you're still going to have to go back to other people that work with that person. And prolonged period of time, I think I've seen something like 10 minutes. So if you're passing somebody in the hall, it's not a big deal. But if you're working alongside that person, you got to notify those other coworkers who've had a prolonged time with that worker. And there is a document that you can use in the Printing United Alliance document if you need some help on how to send that notification out to those coworkers. In order to bring that person back, I think there's a couple of options to do that. Symptom-free, I would go with the test option. I think in the state of Minnesota, I think the testing has been a lot more easily to get at, and I think if you get the two tests that show that the person is not COVID-19 positive any longer, I think that would be a good way to bring them back to work. But there is a couple of options if that happens in your particular case. But you also have to
posted some guidance documents on the chat box as well, just kind of regarding, from the Minnesota Department of Health on, what businesses can or need to do. And then there's I think most of the information regarding cleaning and deep cleaning is still coming through CDC. I think they're still referring everybody to CDC. So there's some information from CDC on how to deep clean, what you got to do, and that kind of thing. And it is apparently a reportable disease, so it will need to get notified to the Minnesota Department of Health that someone has it.
Yeah. And my understanding is usually that the physicians make that notification, but they need to somehow get in the loop. The Minnesota Health Department gets in the loop. The other thing that I don't think we got a question on that one, but maybe someone will ask the question because it's related to that. So what do you do with OSHA? What about notifications with OSHA? So what happens there is if if someone contracted COVID-19 and it really was connected to the workplace, but you really need to investigate that and spend a lot of time to see, did that other coworker get it from from another worker in the building, or was it from a spouse at home, for example? So you need to show that it was really a work-related illness that happened at work. Then you have to put it on that OSHA 300 log.
We just had a comment or a question, I think, saying that an employee didn't have enough symptoms, and so I don't believe they were allowed to be tested. Maybe perhaps they were exposed, but didn't have the symptoms apparently.
Okay, so they were not able to get a test. Sounds
right.
like.
That's the way it seems.
It sure seems like that was the case more in the past than currently now. I would try again, because I think that there's a lot more easily accessible testing. The testing also, from what I've seen too, is less invasive. They can just do mouth swabs. So it's even getting easier now.
Did you want to address the record keeping part of it at all a bit more, or is that?
Well, I think for record keeping, I think just you'd keep your information on, at least for two, 3 years for your training and for your notification to other employees.
Right.
That information, I would just, because there isn't a lot of specificity from that in the OSHA templates for sure.
Right.
Let's see here. So
I think we've gone through all of the questions that I have right now.
Okay. And what may happen too is, just reach out to me and Cathy for other questions. You got to get into the e-loop, because that's the only way we're going to be able to get a hold of people with changes with this or any kind of EHS issue. And again, the PIM Connect is going to have information for members only, and you got to get into that. And I think I urge you to get on over to Ben to make sure that you know your passwords, usernames, and that kind of stuff to get to the PIM Connect, or other people too. If you can get a hold of Sadie or Chris, and they're very helpful in getting you access to that information. I think,
yeah, that is all. I don't have any more questions coming through, unless we hope if we haven't answered your question, reach out.
This is being recorded, so and I didn't say any disparaging remarks about anybody. Specifically at OSHA, I didn't. Maybe a little bit with EAD, but they deserve it. I mean, I think they could have done a little bit better job. Matter of fact, for those people who are very smart about safety data sheets and material safety data sheets, because Cathy and I do this all the time, in one of their prior revisions, they actually used the old term material safety data sheet. That prompted me to say something to OSHA about that. So, but in any event, this is what we got, and I think it's nice that that they're not going to nitpick us on plans. If we have something, we're working towards it, we'll be in good shape. Our advice is that you stay close to what they want to see. If it's a lot of picking around between different memos and different items, they're going to spend more time in your facility making sure that you're covering the stuff that they want to see in the executive order, and how does it, look like on their template. So that makes your life easier for you.
Right.
Well, I guess we'll wrap this up then. Anything else you see, Cathy, coming in?
No, just Sadie just posted some information about how people can access and get into the e-loop. So she.
Oh, wonderful! That's wonderful,
exactly.
Sadie.
Thank you, Sadie.
Thank you, Sadie.
So yeah, that is where we put out, information goes out periodically, and anything new is going to be going into there.
Yeah, I mean, there's just no way we can reach people. We got to pick a way to do it, and sometimes, people are cut off from that source of information because we don't control the distribution in your company. So, and I appreciate that, Chris got that printing industry, Printing United Alliance. Oh, Printing United Alliance, I forgot to kind of go back, is that's the new national organization, folks. Used to be Printing Industry of America. You go back even further than that, GATF. And then there's the SGIA, which is the screen printer stuff. So they're all merged together. So that's the new name. That's what they're called now, the national organization. So Printing United Alliance. All right. Well, thanks for attending, and reach out if you have other questions related to this or other EHS stuff. Good luck.
Thanks, guys.